Welcome to the COVID unit at Odessa Regional Medical Center. This is where the patient care happens. Come on in. So we're here with Sarah. She's our charge nurse for the COVID unit today. And I wanted to just have her speak to you guys about what it feels like to work in the COVID unit. Sarah?
Alrighty. Hello everyone, my name is Sarah. I am the charge nurse here. So working in the COVID unit has been a big challenge for us. It's something that none of us could have ever expected. Being in this get up for 12 plus hours a day is a huge challenge, and with a new virus we haven't always known what to expect. So it's been a learning curve for everyone. We're trying to figure out what's the best thing to do, and it's definitely been a learning process, and we're getting there, and it's definitely been a big challenge.
Sarah, does it hurt? Does it make you not be able to breathe? What does it feel like to be in this for that long?
It's very uncomfortable, but we've kind of learned to get used to it. It is what it is, and we just have to deal with it. We do get a lot of breakdown on your face, but we've kind of learned ways to manage that.
I see you have a Band-Aid on your nose.
I do.
It's because of that strip on the mask.
Yeah. So
Wow.
we've started putting some layers there to kind of help with the breakdown, and it is helping.
Okay. So overall, taking care of COVID patients, does it feel very different to you than taking care of regular patients elsewhere?
It does, just because, like I said, with it being a new virus, it's affecting people in ways that we don't know, that we're still learning. It has been very different, yes.
My name is Tony, and I'm a respiratory therapist here in the COVID unit.
So for the community that doesn't know what a respiratory therapist is, they know what a nurse is. What is a respiratory therapist?
Well, I'm a lung specialist. If you have problems with your lungs or life support, we manage the ventilators. We take care of a lot of different things like sleep apnea patients, breathing treatments, things like that.
What does it feel like to work in the COVID unit day after day?
Well, it is tiring. And of course you have to wear all your protection so that hopefully we will protect ourselves while we're taking care of you or your loved one. It's sometimes very sad, but it's also very gratifying when the patients do get well and go home, and because they come in so sick, and your heart just goes out to them and their families because they can't come and be with them. And it's very hard when the families have to just, see them on FaceTime or things like that. It makes it a lot more stressful for the families.
So for the families who have their loved ones here who are on ventilators or a tube down their throat, they can't talk or they can't interact, how do we do communication?
Well, FaceTime or, a video. I don't know what all programs they have. I do know FaceTime. And the nurse is usually the one that will hold the iPad up to the patients. We've had families, even though the patient can't talk and is sedated, they still will let them call and hold the phone up so that the patient can hear their voice.
That's great. So if you had one message for the community about all your work here, about COVID, what would you want that message to be? What would you want them to know?
Well, for one, it's real, and it's a very, very, very real thing. I would suggest you wear a mask. You're gonna appreciate the fact that you wore a mask and didn't come in contact with this horrible, horrible virus. I mean, simple things like that, hand washing, can make all the difference in the world.
Hi, how are you?
I'm just fine, thank you.
Okay, can you introduce yourself for us? Where are you from? What's your name?
My name is Ida Jansen, and I live in Kansas, south of Topeka.
Wow, what are you doing here at Odessa Regional
I
Medical Center?
came here, I have family that lives here, and my great nephew got married And unfortunately, I didn't make it to the wedding because I got this.
Did you have any breathing problems before you had this disease?
No,
So-
I did not.
So tell us a little bit about what it felt like to get this disease and what that did to you.
It was a very scary situation when you try to take a deep breath and it just like shuts you off and you're just struggling to breathe and trying to get yourself to relax. It's really a scary situation.
Wow. What have you had with regard to treatments so far in the hospital?
I've had, well, besides all my medicine and everything, I do therapy and just work on my breathing technique, and standing up is what cuts your breath off. Sitting down, I can be just fine, but I stand up and move, then it just like cuts your air off. But through exercise and then I wore a CPAP machine for a while there. I had it on 24/7, and then I was able to take it off like when I ate my meals, and then it just got where I could go longer and longer, and now I don't have to have it at all. I only have oxygen when I get up and walk around.
Right. Yeah, I mean, it's saddening to see that even now when you're speaking in a sentence, you stop in the middle of your sentence to take a breath before
Yeah.
you actually finish it. So
Yeah, but I'm so much better now. I've had such excellent care.
it's okay. It's okay. We're glad we're here for you.
This stuff makes you very emotional. At least I blame it on that anyway.
Yes. Yes. So if you had to give any advice to our community that is watching this, what would you want to tell them?
I would tell them to please wear your mask. I'm sorry. Wear your masks when you go out. Even if they're uncomfortable and you don't like it, it's so worth your protection. Wash your hands, sanitize your hands, do everything you can like that to keep yourself, and just stay home as much as you can. That's the best place to be, the healthiest place to be, is at home. I guess I can't think of anything else, sorry.
Well, thank you so much, and we will make sure the community hears your message.
Okay.
I am glad we were able to take care of you. We want to get you home to your family as soon as we can.
I'm going to go home today.
That's great.
It's actually, well, to my brother and sister-in-law's where I stay when I'm down here. But they will take very good care of me.
That's good.
Yes, my name is Tom Reed, and I'm from Odessa here. I've lived here for 15 years, in the Permian Basin about 30 years. Well, this is a CPAC that I started out wearing it quite a bit during the day to help expand my lungs. And then I went to nighttime, which that's not the most comfortable thing in the world, but I can tell that it really helps. There's a lot of fear that the media is putting out, but COVID is real, and it is a lung disease, and it will take time to recover, and I understand that. But I just encourage everybody to wear their mask. Yeah, and my wife were very faithful as far as wearing our mask and using the hand wipes and not touching anything, and we were and keeping social distancing, and we were very careful about that. But as you can see, it can happen to anybody, and my belief is that the mask is for other people's protection. You may not think that you have it, but you just don't know. And I thank the Lord that my wife and my wife did good.
That's good. Somebody was watching over you for
Yeah.
sure.
God was. He has changed my life since I've been in here.
In what way?
I've been a Christian all my life. But I'm a doer. You know, like Martha in the Bible. I love doing things for people. But God has showed me since I've been in here that I need to even that out. And I need to listen more and just let Him speak to me and let Him feed His spirit and His breath into me. And I believe not only is the doctors and the nurses, they are ministering angels. They've been so wonderful, but God is the healer, and He is healing my lungs, and I believe that with all my heart.
When do you think you'll get to go home?
Today.
And I just wanted to let everyone know that we are here. We're ready to take care of you. You know, we've been doing this for several months, and we are at the bedside, you know, 12 plus hours, and we are ready and prepared.
Here in the COVID unit, we're, you know, if you do happen to come in contact with it and become sick, we're here for you and ready and able to take care of you and hopefully make you well enough and go home to your loved ones.
Thank you for visiting us in our COVID unit. You've gotten to talk to some of our staff and some of our patients. You know how real this is. You know how you can protect yourself. And this is what we've been saying all along. We are well prepared for you if you should ever need us, but I hope we never see you here. Stay safe. Wash your hands, wipe down surfaces, and most importantly, wear your mask and keep your distance. Thank you for watching.